research is definitely needed to advance women's health care. More research on women, education and technology is going to be playing a bigger and more important role in making sure women have access to that information.
Advancing women's health care into the future is very much remembering that you are in charge, you the woman are in charge of your own health care and of so many other people's. The doctor is your partner in a healthcare team. You're paying the doctor for the very best advice, and your doctor will do that. But at the end of the day, you have to determine what drugs, what lifestyle changes, what alternative therapies are right for you.
To advance women's health care, I really believe, and I said this earlier, that it's all about prevention. But prevention only happens when you take care of yourself. Eating right, taking the time to exercise, taking the time to de-stress, which is a very big culprit of wreaking havoc on your health, to me is essentials to be healthy. So take the time to take care of yourself, and it's going to happen. You will be healthier and you will be happier.
Our research program is a very extensive program. We have treatment programs in breast, cervical, ovarian, lung, colon cancer, amongst others. And it's very important for our population to be part of the clinical trial initiative. We have 108 different languages spoken at Queens, and just as many ethnic backgrounds and religious backgrounds. So when you're talking about the treatment of tomorrow given today, one of the innovations in the new treatment is that we're trying to target the therapy towards the cancer biology. It's not just chemotherapy anymore, it's really, which targets all rapidly dividing cells. They're literally looking at the cancer cell and trying to target treatment towards what the patient has. And that's something that you need a large amount of ethnic backgrounds to make sure that are represented in these clinical trials to make sure that you are treating the right thing for all patients. What's needed to advance women in healthcare is working with all these partnerships like Queens Hospital does. We have a program in a clinical trials area where we were nationally recognized. We received a grant that has expanded our research program to bring more clinical trials to patients. And so I think that working in these partnerships, we work with Sloan Kettering, we work with Mount Sinai, we work with American Cancer Society to have different programs run at a small center like us that is ethnically diverse, that doesn't receive a lot of donations. This work can be done even in the public hospital system.
I would love to see us take our personal experiences and our personal expertise as businesswomen, but also as the healthcare chief marketing or chief officers in our own families, and understand that we can translate that and make a difference in the way we talk about healthcare, in the way we present healthcare, and in the way we include populations so that they can also make a difference in their own lives.
Osteoporosis is predominantly a women's disease, and it's also a public health crisis. So we want women to understand their risks, what their choices, especially through lifestyle, are, through better exercise, through nutrition, how they can become models of healthy aging as well, and how to prevent fractures and understand what their choices are through living a strong, long, healthy life with vitality.
AMWA's final hopes and wishes for advancing women's healthcare innovation are to keep women's healthcare and the needs of women at the forefront of medicine, and to support research and education that addresses the unique biology and perspective of women. Women's healthcare innovation also means ensuring care of the practitioner, that they have the resources, education, and skills to provide good evidence-based medical care to their patients.